we will start with the difference or the various types of shock. We have 5 different types of shock. I will just give you the different types of shock first. Yeah. And then we will deal with each separately. Okay. So, just look at here. There are 5 different types of shock. Hypovolemic shock, cardiogenic shock, distributive shock, septic shock and obstructive shock. First, we will start with hypovolemic shock. Hypovolemic means hypovolemia. So, the child is losing so much of fluid, so much of blood. It can be either. There is so much of fluid loss is present. This will cause a decreased preload. Okay. So, there can be plasma loss, there can be blood loss, there can be water loss, there can be electrolyte loss. Collectively, what it will do, it will cause a decreased preload. So, that is the pathophysiology in a hypovolemic shock. Next type of shock is our cardiogenic shock. As the name suggests, cardiogenic shock means the pathology is present in the cardiac. So, the cardiac contractility is the problem here. The heart is not able to pump. So, there is a cardiac pump failure. This can happen after a myocarditis, after in cases of congenital heart disease, it can happen in cardiomyopathies, it can happen after a cardiac arrest, etc. Isn't it? So, this is the cardiogenic shock. Next type of shock is the distributive shock. Distributive shock is the problem here is in the blood vessels. Okay. The peripheral blood vessels are abnormally vasodilated, right? So, the heart is functioning normally, there is no fluid loss, nothing. But in the periphery, we see that there is vasoplegia, there is abnormal vasodilatation, there is decreased systemic vascular resistance. Okay, so this is the pathophysiology in a distributive shock. Where all distributive shock can be seen? 1 is septic shock, 2 in anaphylactic shock, 3 in neurogenic shock, especially after a spinal cord surgery, etc. or a spinal cord injury, neurogenic shock happens, or in cases of poisoning. Okay. So, coming to the next different type of shock is our septic shock. Septic shock can happen or can present like any of these 3, what we have seen so far. Okay. Septic shock can present like a hypovolemic shock, it can present like a cardiogenic shock, or it can present like a distributive shock. The timeline will vary. It can present like a distributive shock initially, and then it can present like a cardiogenic, or it can present like a distributive, and then it can go like a hypovolemic shock. So, septic shock can present like any of the 3 shocks that we have described just now, right? Last type of shock is your obstructive shock, where there is obstruction to the outflow. Like there is obstruction to the right ventricular outflow or the left ventricular outflow. So, because of the direct impediment, this type of obstructive shock is the one which will go for a increased cardiac arrest, a very early cardiac arrest. Okay, this obstructive shock. It is our duty to find out obstructive shock immediately. Example, cardiac tamponade, pulmonary pericardial effusion, pulmonary embolism, tension pneumothorax, etc. So, all these can cause obstructive kind of a shock. Okay, so now you know there are 5 types of shock. Hypovolemic, cardiogenic, distributive. Septic shock can be any of these 3, or it can be collectively present also. The last type of shock is your obstructive shock.